Hi, my name is William Anton, and I'm a student nurse here at the University of South Alabama, and today I'll be performing my medication administration checkoff. So the first thing I would do is perform hand hygiene. I would be in a no interruption zone, no cell phones, and I would just be focused strictly on medication administration. So here with me, I have my MAR and my patient care order form. And I'm just going to compare the two to each other. So I have Jaguar J. Jones, date of birth 08/25/1963, date of birth 08/25/1963, medical record number 4176352, medical record number 4176352, allergies, penicillin, heparin 5,000 units subcutaneously every 12 hours, heparin 5,000 units subcutaneously every 12 hours. So since I verified that, I'm just going to go ahead and put my patient care order form out to the side, and I'm just going to go ahead and go through my first 7 rights. So we have Jaguar J. Jones, date of birth 08/25/1963, medical record number 4176352, allergies, penicillin, heparin 5,000 units subcutaneously every 12 hours. And here I have my heparin 10,000 units per 1 milliliter, and the expiration is 12/5/2025. So I am going to have to do a dosage calculation for this, and I would verify this with another nurse. So heparin, we have a heparin vial with 10,000 units, and I am administering 5,000 units subcutaneously every 12 hours. And I would have to do a dosage calculation. So 5,000 units is equivalent to 0.5 milliliters. So that's what I would draw in my 1 milliliter tuberculin safety syringe that I have here. But again, we have Jaguar J. Jones, date of birth, and this is my first 7 rights. So we have Jaguar J. Jones, date of birth 08/25/1963, medical record number 4176352, allergies, penicillin, heparin 5,000 units subcutaneously every 12 hours, and heparin is an anticoagulant, meaning that it prevents blood clots, and all elements of a legal prescription are intact. So now I'm just going to, since I verified my first 7 rights, I'm just going to go ahead and open my 1 milliliter tuberculin syringe, which is good for subcutaneous injections like I'm doing today. But before I open my 1 milliliter tuberculin syringe, I want to go ahead and open my heparin vial. And I just want to get a alcohol pad and open it, and just clean off the top of this vial. Now, since I've done that, I just want to go ahead and open my 1 milliliter tuberculin safety syringe. And I'm just going to put the safety cap out to the side. And I'm going to be administering 0.5 milliliters. So let me draw that. Okay, perfect. So I have that done. I'm just going to go ahead and put on the safety cap. And I'm a scoop method. And here we have 0.5 milliliters. So I want to go ahead and make my label. And again, I would check this dosage calculation with another nurse. All right, so we have Mr. Jaguar J. Jones. He has allergies to penicillin. His medical record number is 4176352. And he is being administered heparin 5,000 units, which is also equivalent to 0.5 milliliters, which we have in my tuberculin safety syringe. And just gonna double check. And Mr. Jones has not had his heparin, so this will be his first injection. So since I have my label, I'm just going to go ahead and show this label that I created. And it contains Mr. Jaguar J. Jones' name, medical record number, allergies to penicillin, and he's being administered heparin 5,000 units, which is equivalent to 0.5 milliliters. So since I have that done, I'm just going to go ahead and put my label on my syringe. Okay, now since I have that done, I'm just going to go through my 7 rights for the second time. So we have Mr. Jaguar J. Jones, date of birth 08/25/1963, medical record number 4176352, allergies penicillin, heparin 5,000 units subcutaneously every 12 hours. And again, I have 0.5 milliliters in here because 5,000 units is equivalent to 0.5 milliliters. And heparin is an anticoagulant, meaning that it prevents blood clots, and also all elements of a legal prescription are intact. So now I'm just going to perform hand hygiene. I'm going to gather my supplies, head over to Mr. Jones' room. I'm going to make sure I knock on his door first. I'm going to perform hand hygiene again. Hi, Mr. Jones. My name is William Anton. I'm a student nurse here at the University of South Alabama, and today I will be administering your heparin medication to you today. And the first thing I want to do, I'm just going to look at Mr. Jones' arm and just make sure I don't see any abnormalities, any redness, I'm going to see if he feels any pain or tenderness in that arm. I'm going to do all the safety precautions before injecting Mr. Jones. And I'm just going to perform hand hygiene again. I'm going to raise the bed to working height, making sure I let down the side rails. And again, just making sure Mr. Jones is in good condition, making sure his arm is well. This is a subcutaneous injection, so I would be looking at the skin of the abdomen. And Mr. Jones, this is a subcutaneous injection. I could give it in the dorsal lateral, or I could do it in the abdomen, but today I'm going to do the abdomen. So I'm going to stay below the coastal margins, but above the pubic regions. I'm going to stay above the pubic area. And I'm going to stay in between the anterior superior iliac spine. I'm going to stay 2 inches away from the umbilicus, and I'm going to be in a U shape. I'm going to give these injections in a U shape, 2 inches away from the umbilicus. And again, these injections will go in this single injection will go in a U shape. So again, prior to doing that, I'm just going to look at the skin, assess for any redness, any abnormalities, and making sure Mr. Jones doesn't feel any tenderness or pain. So now I'm just going to do my third check of my 7 rights. I have Mr. Jaguar J. Jones, date of birth 08/25/1963, medical record number 4176352, allergies penicillin, heparin 5,000 units subcutaneously every 12 hours. I'm just checking my MAR, and now I'm just going to go over to Mr. Jones' armband. Again, perform hand hygiene before touching my patient. I'm going to look at his armband. Okay, we have Jaguar J. Jones, date of birth 08/25/1963, date of birth 08/25/1963, medical record number 4176352, medical record number 4176352, allergies to penicillin. Okay, and again, heparin is a anticoagulant, meaning that it prevents blood clotting, and all elements of a legal prescription are intact. And again, heparin is going to be administered to him 5,000 units subcutaneously every 12 hours. In my vial here, I have 0.5 milliliters, which is equivalent to 5,000 units. I just want to go over this again, so I'm just going to do it again. I'm just going to do my third check for my 7 rights one more time. So we have Jaguar J. Jones, date of birth 08/25/1963, date of birth 08/25/1963, medical record number 4176352, medical record number 4176352, allergies penicillin, heparin 5,000 units subcutaneously every 12 hours. Again, Mr. Jones has not had his heparin today, so this will be his first injection. And we have the 0.5 milliliters in the tuberculin syringe right here. And heparin is an anticoagulant, meaning that it prevents blood clotting, and all elements of a legal prescription are intact. So the first thing I'm going to do again, perform hand hygiene, apply my goggles, and I'm just going to go ahead and apply my gloves. Alright, again, I would be looking at the skin of the abdominal area, assessing for any tenderness, any redness, any abnormalities, making sure I'm giving this injection in the U shape, staying away from the umbilicus. And this is a subcutaneous injection, meaning that I can go in a 45 or 90 degree angle. I'm going to take the route of the 90 degree angle. I'm just going to go ahead and prep Mr. Jones, and I'm just going to tell him what's happening today. So Mr. Jones, today, again, the bed, I would have it at working height above my waist, and the side rails would be down. And now I'm just going to explain to Mr. Jones what we're doing. So today you'll be getting your first heparin injection of the day. It's going to be administered to you in the abdomen subcutaneously. And again, I would position my patient for comfort and assess again for any abnormalities. So I'm just going to go ahead and get my alcohol prep pad, open it, and I'm just going to clean the injection site from inside out. Alrighty, injection site is clean. I'm going to get my syringe, I'm going to open it, and I'm going to make sure I pinch 1 inch of skin, going at a 90 degree angle, inject. Okay, and I'm putting this in my sharps container. Mr. Jones, how did this injection go? How are you feeling? I would make sure Mr. Jones is comfortable and well. I would tell him I would go to the nursing station to perform documentation of how he performed during this injection. I would know anything he may have told me, if he had any tenderness, any pain. I would know any redness. I would know any abnormalities when it comes to Mr. Jones and this injection. And I would tell him I would be back in 15 minutes to assess him and make sure he's doing well. I would then raise the guardrails on the bed and let the bed back down and get him in a comfortable position. I'm now going to take off my gloves, well, my goggles, then my gloves, perform hand hygiene, and that would complete my medication administration checkoff.